Доброе утро. Я предлагаю начинать. У нас есть опоздавшие, есть не успевшие приехать. Ну, достаточно много участников.
So we have many those who are here, and so let's begin. I'd like to begin with a phrase of Robert Kiyosaki, as a famous guru in investment and business, and he said the following: "So you will be making mistakes many times, but if you learn, then you invest in your wisdom. But if you invest in wisdom, you invest in riches, and riches, in our sense." Is our health. That's the nation's health. So let's think about it. And our session is correcting the mistakes. That's the name of our session. So that's the how to invest wisely. And so the investment is a very important method of business development, not the pharmaceutical business. At the same time, it contributes to the efficiency of healthcare and accessibility of healthcare, of medical support for the population. So then the tentative analysis shows that in the last 10-15 years, a lot of money has been invested, considerable amounts of money in the pharmaceutical industry of Russia and the healthcare system of Russia. But we don't have the exact data about the volumes and the components of those investments. And we don't have the accurate assessment, unfortunately, of the impact of the investments on the social indicators. And I wouldn't be surprised if private companies and the states, so they have different definitions of the term of investments, and there are different criteria of the results of those investments. So they look at it differently, the state and private businesses. That was the consultative council on foreign investment council. So they discussed this issue recently, and jointly with the pharmacological group of this investment council. So they start full-scale research or study in order to analyze the types and volumes of investments and funding. So both done by both Russian and foreign companies in the area of healthcare and pharmaceutical industry, and identifying the main criteria of the attractiveness and the success factor. And then summing up the results, to understand the success factors, limitations, and definition of promising areas of future investments that would guarantee synergy of state priorities in the healthcare system, and at the same time, development of business of pharmaceutical business in Russia as well. So then, one housekeeping point. Asking questions is a part of the study that we launched today. So we have 5-7 minutes for speeches and 5-7 minutes for questions and answers. I'll show you some statistics and then we'll move over. And our original report shows the following figures. If you look at more than 400 deals occurred since 2005, and almost $3 billion worth of investments along those lines. So then manufacturing investments, building new facilities, more than 74 billion rubles. So then private investments 2020 program. So comes up, the disbursements almost 120 billion rubles. More than 45,000 jobs have been created. That's only in the pharmaceutical industry. And then in some, and other related industries. So more than 22,000 different drugs have been registered in the state register, and more than 100 different social and projects jointly with the state have been launched by the charity organizations. So by pharmaceutical clusters, 11 clusters. And so you can see that a big layer, it's a very deep layer, and a lot of work has been done in the last 15 years. So what's investments? So investments is investing capital to achieve certain ends. So that's both social and economic goals need to be achieved. That's the purpose of investments. So I try just to break down into different types all these investments. And I think that not all participants at this roundtable discussion will agree that this is the type of the breakdown that I offer, and it's true. So first is acquiring assets, so buying manufacturing assets. That's the first investment. So different product lines of different drugs. So then strategic partnership. That's the second category. So contractual production. So joint stock companies, strategic alliances. And so then social projects and charity, and so social projects, different charity events, direct investments, and then building factories and manufacturing facilities in Russia. And so because we then certainly labor market is certainly creating jobs, not only in the pharmaceutical industry but in other so closely related industries. And so the efficiency factor is more than 4,000. It means that so building the pharmaceutical industry so involves a lot of other industries that certainly are brought into this orbit. And so then the R&D. And so using the services of labs, joint projects, education, and thus investments in regional and federal educational medical programs, investments in internship programs, postgraduate studies. So then key, so raising the, advancing the professionalism of the medical practitioners, etc. So there are the points for discussion. So are we on the same page when we speak about investments on both on the side of the private investor and the state? So that's how do we appreciate, how do we evaluate the effectiveness of investments? So what kind of standards and approaches so when it introduced to bring these positions closer? What are the priorities in the system of medical care, and whether the pharmaceutical companies are ready to continue investing in the Russian Medicare system, and how. That's our first question I'd like to put to the regions, since the regions they are the locomotive, the driver for attracting investments, for raising funds, participation in federal programs, and developing their own regional programs. Could you identify regional or federal programs and talk about them, pilot projects that have been successfully concluded or are in progress? And so with both, not only public capital but private capital as well. Not only state disbursements but private capital. Thank you. Good morning. So first, I wanted to point out to you that so that in Tatarstan the upgrade started in 2011 as one of the main program of modernization, and it started not only in 2011 but earlier in 2006. So the regional money was used, and so then so lots of hospitals and outpatient hospitals, 3 billion rubles. Were disbursed so to upgrade hospitals and outpatient. Because the program of national health care is a success story, and it started in 2006. This is the event at the basis of which so we had the creation of three-level system of providing medical care. So with so brain circulation, so then suffering from the results of traffic accidents and other things, and emergency help. So then co-financing has always been at the top of the agenda, and so always co-finance more than the terms provided. So this once the private company offered some financing, we always matched it even more than 1-to-1. And so, but at the same time, I want to point out that creating 3 regional centers, and the task is to increase the accessibility to high technological medical support. And so has been done with the help of non-state hospitals. And a good example and a success story is so the Almetievsk hospital. So it's non-state hospital. It's located in Almetievsk, is the capital of the oil people. And in 2007, the cardiological department was successfully commissioned. And that oil company invested more than 3 billion rubles in that. And this high-tech center now provides medical services to many districts. So that goes on. So we have open heart surgeries there. So there's cardio surgeon, Mr. Akhchurin. So we have his disciples there. And certainly the most important component is not only the availability of infrastructure, but it's the certainly personnel, professionalism, surgeons, doctors, general practitioners. So those who are interested in providing high-quality professional medical care, high-tech care, so that our region can provide. That's a good example of a state and private cooperation. And so we had already had a lot of surgeries. So with the use of coronary angiographies have been conducted. 800 stenting surgeries have been conducted. Then open heart surgeries have been conducted, and then with the artificial blood circulation system assisted surgeries have been conducted successfully. Another oil company invested more than 350 million rubles in yet another polyclinic. That's another area of development. So thus we have 17 cardiovascular centers. So we have 7 centers of coronary and heart intervention surgical institutions, and that allows us by the results of the year of 2016. And so then the mortality of the heart failure has dropped down drastically. And so this is a systemic, holistic approach, and we need just to push it forward and follow through on that. And I need just to point out that about 11 billion have been raised only with the help of the fund of the mandatory medical insurance fund. So this money came from that fund, and so these events, so they received other co-financing effort from our region, and the money the money was channeled to the leading hospitals and polyclinics, and that helped the program of the modernization of diagnostics departments in all leading hospitals and the central outpatient clinics, and so that certainly contributes to the accessibility, availability of the medical support for the patients. And so the issue of efficiency of providing medical care. So we've been paying a great deal of attention to it. So we looked at it from the viewpoint of to what extent our hospitals, so that go back 30, 40 years, and so how can they be efficient? To what level? So they cannot be efficient if they're not properly upgraded, renovated, if we don't have new equipment, and if we don't have new surgical departments. So with the state of the art, so emergency departments, intensive care units, etc. Without it, it's not possible. The center of emergency medicine that was built on the decision of Mr. Putin in 2013. So this emergency medicine hospital. So more than 5,000 patients have already been treated. So 82 surgeries in one day. That's a record number of operations in one hospital a day. And so certainly this is all very, very impressive, and that's a good start and good experience that we need to certainly replicate in other big cities of Russia. And thus, I can conclude this 3-level system of medical care provisioning continues to exist. So now we're building a center of radiological center of oncological center. So we're planning to build it in Almetyevsk, so this oil people city. And so that's why we need this to build it in close proximity. So for the oncology patients, creating regional centers, building regional centers that they can get chemotherapy, radiotherapy. So it's very important because the accessibility now has improved drastically. It takes no longer than 1.5 hours to get to that hospital. So we're designing one. So now we're designing another center in Naberezhny Chelny city. etc. So this the accessibility, the availability. So we take this benchmark from Europe, and so we reduced 3.3%. The mortality went down last year, so, and we saved more than 1,500 lives. And I think that this is the result of our effort, of our combined efforts of all these measures. And then I can't help mentioning about the human capital. So then investing in human capital. There is an educational center, so high-tech medical technologies, and in 2008 was commissioned. Mr. Medvedev came for the commissioning, and the Transcontinental Johnson & Johnson Corporation participated in that. And so then so more than 10,000 students have gone through the studies and graduated successfully. So 3,000 of them from Tatarstan Republic and 7,000 from other republics. And so then certainly, so that's the basis. This is the basis, the core, the flower of the medical practitioners. So that's another success story. And certainly we need to invest in such projects more and more, because we need specialists, professionals who will be able to work the complicated equipment that we have. And certainly we need to think about certainly innovation and introducing new technologies. And so one of them is creation this university clinic on the basis of Kazan Federal University. It's attached to it, and so where they train the doctors who are going to be involved in the basic research. Thank you. And now I would like to give the floor to a representative of the Ministry of Economic Development. What are the investment areas in this area and in the medical, in the healthcare system? What are the priorities in the healthcare of Russia? So human capital development, we need to talk about not so much development as retaining it and reducing mortality and increasing life expectancy. These are the most important things. Investments-wise, so the priorities are the ones that will allow us so to reduce mortality. So we cannot just drastically reduce it, it's unfortunate, but so slowly we can reduce mortality, and we're trying this. And I was at one of the meetings on mortality in 2006 when they started to invest a lot from the state, from private entities. So we managed to reduce mortality. So we had 15.1 in 2006, and so now 12.9. And so which is much better. So then year by year compare. So 10 years later, so the investment is just investing in human capital. So then that's why the mortality has gone down. And so this is certainly the primary medical care is very important, because without the primary medical care, the system will not work. And so because we can invest in high-tech medical support, certain equipment, etc., building state-of-the-art medical centers is a very important priority. But without the primary window, where a patient will come and ask for help, so if we don't do that, so we'll not be able to make progress. And that is why so we welcome so that businesses, commercial successful projects, also investing in primary medical care, because this is the frontier, very important, and we welcome these investments in this area. And at the same time, the system has been balanced in a way that business, when it comes to this area, so we need just to create, so it would be, business is business, so they're after money, and that is why we need to create good, propitious terms, so that business would feel comfortable. So this is the most important task, to create. So because we have many examples of private business support, involvement, when business invested in nuclear medicine, for example, so that's very costly. And so it's a commercial project, but it works, it pays off. So now just we need to create conditions so that the business within the system of medical care would feel comfortable and wouldn't be afraid. For example, in nuclear medicine, so it's one of the most successful projects in Russia, and I think that we'll talk more about that. But we need just to do everything just to make sure that other businesses will follow suit, because that's very important in diagnostics, in treatment. So all this complicated. So we welcome investments everywhere, certainly the high tech, low tech, etc. But at the same time, we need to. So the medical system need to create good, cultivated atmosphere for private businesses. And so now. So we cannot certainly. So because the budget, the fund is limited, and so then it's 7.1 trillion, but it's just paying for the medical care and etc. So we're in difficult economic situation, so we cannot invest more. So we cannot just increase any insurance contributions until 2018. This is impossible, and so that is why. This fund is finite, and so that is why if we increase the burden on businesses, then they will stop investing, and then it's a multi-layered system. So there's a budget, so the constituent units federation, so then the federal money, then the private money, etc. So and so then. It's a multi-layered system, and so I think that we need to find additional source of investments within the system of mandatory medical insurance, because maybe private businesses need to hook up to it, and so they need to help. But the basket, so that's how much we put into the basket, that's how much we spend, and we know the sources, and we need to find other sources, and so then we need just to find other sources, for this basket, so to fill it better, and we need to realize how we spend the money. So depending on if we know just how much we have in the basket, so then if we manage to add to this basket and medical and mandatory medical insurance, it will be a big contribution. Then building high-tech centers, state-of-the-art technologies, so is limited because it's not widely spread, because it's very costly, very expensive. Not many regions can afford building new high-tech centers. But we still need to think about the primary care. And so what kind of system we can discuss, what we want to get. But certainly the most important thing is increasing life expectancy, reducing mortality, and so then newborns mortality is another thing. And so when we started this project, we did not think about the three level system of medical support in 2006, but we understood that if we do not invest, then we won't be able just to make any breakthroughs. So then the expectancy will dwindle. And that is why at that time we had no idea that it would be a three-layer system. And just we started to get real money, good investments since somewhere in 2008. And we realized that if we start investing now, so we'll get the impact much later, because the system of health, but we want just to speak with our colleagues from the ministry. What are the priorities for them, so that we would be on the same wavelength? And so what priorities for us, what the priorities are for them, and that's exactly how we're going to follow up on that. And so because we need just to stake out this ground and understand and see if we are on the same page. And so then business is one of the sources of financing. That's true. And but yeah, so because we need to attract businesses, that's what was said earlier. Let's listen to the other side of this. I'd like to Vladimir Nosov, please. Vadim. So that last couple of years, so there've been many changes in the rules of the game in the market, and so legislation changed, and regulation framework, environment changed. What's your assessment of the current changes in the legislation and different initiatives? And can you participate in their implementation? Are there any additional proposals? What kind of projects may be put in on the table for further implementation? As you know, Novartis is one of the first which responded to the government's request to participate in 2020 pharma program. So made a decision to build a plant in 6 years ago, and now we're beginning for shipments. So we built this plant. And the specifics of the pharmaceutical industry and so in Russia is that it's supervised by several state institutions. So this is Ministry of Health, Ministry of Industry, Ministry of Economy, and Antitrust Service. So they all supervise it. And it is true that the rules of the game, so when we started, they were not determined. Everything was based on our goodwill and understanding that investments, so they are vitally important for the companies. And if any company would want to make investment, they should be certainly feasible, they should be logical, and they should be mutually beneficial. That was the assumption. But now, in the last 2-3 years, we see then the budget situation exacerbates, becomes more difficult, and the implication is that there are more discussions now about the fairness of prices and about the availability of medical help and the availability of drugs, and because of the budget constraints. So we need to take into point a new trend which is being born in the whole world now, that we need just to connect prices, to tie in prices, budgeting, with the efficiency of treatment. So, for example, so then the availability of drugs, this is generics. So I'm talking about generics. And so the non-patented generics, so that any company can manufacture because the patents expired. But the pharmaceutical industry is a very innovative industry, and all these innovations, or research, R&D, and so they're aimed at increasing efficiency of the drugs. And the innovative drugs that are patented, because generics cannot be done on those patented drugs, so they will always be in contradiction with the budget capabilities. So the companies say that they're better, and the budget says so we can't afford it, so we cannot provide this new patented drugs for everybody. To everybody, and that's why in the years to come we need just to pay attention to this. In English, it's called outcome-based payments. So there is no direct. So the best translation is is the value medicine. Is when the payment is made after we know whether the treatment helped or not, whether the drug helped or not. And so naturally, this is it will always be. We need to prove it, and so for this we need a special institute, certain platforms, so that would guarantee the efficiency of proving the efficacy of different drugs. So for example, this is a shorter hospitalization or just no increasing life expectancy. So there may be, but we need to do that. And so those will be the factors that would be determined. So we need just to launch some pilot projects with some therapeutical industries, and we as industry ready to participate. So the first experience, we have accumulated some data, and we've done it. One pilot project for the Ministry of Health, and so for some therapeutical areas, and we're planning just to launch a pilot project on that. Efficacy-based medicine. Also, next question I'd like to put to Jane Griffiths, chairman of the board of directors, Johnson & Johnson. Jane, so yesterday, Mr. Medvedev said that Russia had gone through the most critical phase economic situation, but the economic situation still is not easy. Still is not easy. Do you think that the medical care industry can become a driver for pushing the economy for because talking about human factor investments, could it become a locomotive for just pulling the nation out of, and how it's related, so the health of the people, and so to what extent so the health of the people can impact the macroeconomic indicators of Russia.
The government, President Putin talked about it during his latest address in the Council of Federation, and also Minister Svortskova underlined the importance of improving health of Russians as a contributing factor to growth in the economy. And at Johnson & Johnson, we're very pleased to partner in this. We've been here for 25 years now. We employ 2,000 people here. And a recent study has shown that the multiplication factor for our employees is about 2.3%, so a significant impact on employment in Russia. So I was interested to listen to the translation of Ms. Mikheeva's talk, because I fully agree that, you know, improving the health of people in Russia is going to deliver improvements in the economic position of Russia. Delivering efficient and effective healthcare services can create returns on investment and contribute to communities and businesses, and spurs economic growth. I think it's no surprise to anyone that you know, data from Harvard, for example, estimates that 1 year of improvement in life expectancy is linked to a 4% increase in GDP. And you know, Russia is making great strides in life expectancy, but it's still not up where the life expectancy is in Western Europe, for example. So. Also, cardiovascular disease is a leading cause of death worldwide. We all know that. 38% of death in Europe, 50% in Russia. And a study in China again showed that reducing deaths from cardiovascular disease alone by just 1% a year for 30 years could generate economic value of $10.7 trillion. So, you know, improving the health of people can contribute directly. I know there's a discussion here about direct investment in Russia, but I think we should not underestimate the importance of improving health in terms of creating economic value. Every year, poor health amongst workers reduces the global economic activity by about $2 trillion US. And a WHO report in Russia has shown, for example, every employee misses 10 work days a year. So improving the health of people in the workplace is going to contribute to productivity and therefore the economy. And the healthcare sector in general is one of the largest sectors in the global economy. It's also the fastest growing, and you know, well-functioning healthcare system drives growth in other sectors of the economy. The pharmaceutical industry itself contributes significantly to value and economic prosperity. In the EU, for example, the industry employs 70,000 people, and as I said, in Russia, we alone employ 2, with a multiplication factor of about 2.3. And, you know, the pharma industry and private sector play an important role in improving public health. They make a significant contribution to the economy, enabling growth, improving demographic structure, and driving social stability. Implementation and wide use of innovation will stimulate the increase and efficiency of budget usage. And I was interested in Mr. Vafin's comments on the introduction of new technology in the hospitals to improve healthcare. So, in the medtech arena, of course, that's very important, but equally well, the introduction of new and innovative medicines can also contribute to effective healthcare systems. And I think that it's important that we as an industry articulate clearly that we do bring high-tech medicines. Yes, they cost more than generics, but as Mr. Vlasov was saying, they have an important contribution to healthcare systems in terms of reducing healthcare costs. But most importantly, improving people's lives and also extending people's lives. I mean, I think the important thing in many countries is to continue to work on life expectancy and also on a reduction in morbidity in populations, so that we have healthier workforces around the world that contribute effectively to our economies. So, you know, medicines can offer that value to the economy, and we as a company are really pleased to be involved in the projects that Mr. Vlasov talked about as well, where we're going to do some pilot projects to look at new technologies and how they can improve health through the way that these projects are implemented. And I think what we want to show is that it's possible to introduce modern new drugs into the system with innovative pricing schemes, looking at outcomes and seeing how well we're impacting the health of people in Russia, and showing that maybe we can reduce hospitalization, but more importantly that we improve the health and the life expectancy of people here in Russia. So as a company, we look forward to that continued partnership, and I just want to reiterate that as a company we do also invest locally through partnerships with companies like Pharmstandart, but we shouldn't forget that the biggest contribution that our industry can make is to the improvement in life expectancy and improvement of health of people in Russia. Thank you very much.
It's just short summary. The health nation is the health economy.
Exactly.
Yeah, thank you. Я хочу адресовать свой следующий вопрос. Can you push the button, please? Thank you. Я хочу адресовать свой следующий вопрос еще одному представителю международного.
Another question. Jeffrey, representative of the company, Brandon. I'm sorry, I didn't get the name right. I'm sorry. So very close to the subject matter. So what are the priorities in your mind the state can have from the viewpoint of investments to make pharmaceutical industry more competitive? And how would you assess the return on this investment? Would it be profitable for private companies to do that?
Thank you, Dimitri. I appreciate very much, first of all, I mentioned I think, for instance, I think EY is asking a lot of the right questions here in the study that's been commissioned. I've been taking notes yesterday, this morning, and I think in a word, if I were to summarize my comments, my observations in the next few minutes, it's really opportunity is the word. I think we have an opportunity in Russia in all sectors, but in particular in the health and biopharmaceutical sector, and in the innovative sector in particular. I'd just start off with a preface that I think we speak with some authority as MSD here. We're globally celebrating our 125th year as a company, about our 25th year here in Russia. We're active in both human health and animal health. Company is involved, is at the cutting edge of science. Last month we were very happy to see the progress we're making, for instance, against Ebola with our Ebola vaccine. In Russia, we have about 750 employees. We are involved in a wide range of activities, operations from research to manufacturing via local partnerships. And we market a full line of innovative vaccines and medicines. I think I'd focus in the next couple of minutes on 3 points, Dimitri. One is a vision for our sector in Russia, because I think a lot of times, and this is something I see in many countries around the world, we get bogged down in the details, the technicalities, the issues of the day. I'd also say something about competitiveness. I think that's a key concept for any country that aspires to be successful in this sector. And then finally, the importance of dialogue. Part of our dialogue, ongoing dialogue with the government, we're looking at a piece of it this morning, but it's not something that happens one time, once a year or twice a year. This is something that almost needs to happen at a daily level if we're going to be successful. So on the vision, I think the first thing I'd point to is Russia's a G20 economy. And I think we've made a lot of progress the last 6-7 years in Russia, but we're not quite yet a P20 country, a pharmaceutical 20 country. So we think that, in our view, in our vision, we see that Russia's a G20, but it's also a P20, a pharmaceutical 20 country. Pharma 2020 has been very important in terms of setting out that our sector, the biopharmaceutical sector, is a strategic industry, is a strategic sector in the Russian economy. So that's a very important statement about where we want to go. We're 7 years into the Pharma 2020 strategy. We've made a lot of progress. I do wonder, though, as a company investing here, employing here, innovating here, maybe as we're getting into the 7th, 8th year, is it time for us to think about Vision 2030, the next 13 years, so that we're staying competitive and have something to shoot for over the next 13 years. Maybe an update of the 2020 is important. I'd like to set the context. Conservatively, we invest about $100 billion a year around the world as a biopharmaceutical sector. There are some statistics, some figures that point to maybe $140, $150 billion a year. That's an enormous gusher flow of money around the world. I think it's important to keep in mind that about only 20 billion of the 100 billion is bricks and mortar, is plants, equipment, facilities. About 80 billion, 80%, is R&D. So, I think Russia's focused a lot on manufacturing, production, bricks and mortar. That's important. Dmitry, you laid out some figures. There have been impressive progress the last 6-7 years in that area. But I would underscore that in the pharmaceutical 20 countries, the top most competitive countries in the world today, there's typically a very big focus on the $80 billion on the R&D piece. That gets me to a couple comments about competitiveness, so point number 2. We see in some countries around the world, and I work in Latin America, Eastern Europe, Middle East, Africa, again, there's people create, I think, artificial dichotomies. Should we have a generic industry, local industry, or international? Innovative. Our advice as a company, and I think as an industry, is to check the all of the above box. It's okay to say we want a vibrant, strong local generics industry, but we also want a strong, thriving, innovative industry side by side. And you see that all over the world. You can go to Switzerland, you can go to Germany, the United States. You'll see that the two sectors are mutually compatible and thrive side by side. The other box to check is the all of the above box on manufacturing and R&D investment. Again, I think we're cheating ourselves a little bit in Russia if we're not focusing on where the big money really is in the sector, which is R&D. There was a famous American bank robber, kind of a celebrity bank robber named Willie Sutton. And the media, the press caught up with Willie Sutton at one point, and they asked him why he robbed banks. And Willie Sutton said, well, that's because that's where the money is. And I think I'd remind people that the real money, the real value chain for us, the real money is over on the R&D side, not to ignore the manufacturing. I think the new EY study will help us spot a lot of important opportunities. I think it'll help us tie what are the policies we need to drive to achieve those opportunities. One simple goal is to think, if we're thinking about $100 billion a year, can Russia attract 1% of that, 2% of that, 3% of that? $1 to $2 billion a year in investment is achievable in Russia. I think you've started to put a lot of the important policies in place to become more competitive in that space. But the observation we have around the world is that being competitive is hard work. It requires putting in place efficient, predictable regulatory systems. It requires high standard intellectual property standards. It requires competitive taxation policies. So there are well-known components here, and in Russia we've been talking about those. Progress has been made on those. I wouldn't discount the importance of predictability and transparency as features of highly competitive countries in the P20. So finally, last point is observation is the importance of dialogue. How do we achieve Russia's position in the P20? How do we achieve a highly competitive, successful Russia in the biopharmaceutical industry? I think dialogue is essential. One of the advantages we have here in Russia is that MSD, Janssen, J&J, Novartis, many of our companies are very well established here. We've been here for many years. We have the global perspective. We can share with you what makes countries competitive around the world, not to copy-paste, but certainly maybe to leapfrog ahead in terms of enabling conditions and policies that we might put in place here in Russia. I think MSD as a company kind of mirrors that ratio. We invest about $6 billion a year in R&D, about $1 billion a year in capital investment.
Jeffrey, I have to remind about
Yes.
timing, sorry.
And I think that certainly there's a lot for Russia to shoot for here in terms of attracting new investment. Thank you very much.
Thank you. Поскольку мы заговорили уже об исследованиях R&D и неокре, я бы хотел задать вопрос представителям компании AstraZeneca. Какова ваша оценка возможности инвестиций в исследование и разработки лекарственных средств в России? И возможно ли дальнейшее развитие фармотрасли без инвестиций в исследование и разработки?
Добрый день, доброе утро, уважаемые коллеги. И прежде всего, позвольте поблагодарить за возможность участия в такой интересной экспертной дискуссии. И компания AstraZeneca, безусловно, является мировой биофармацевтической компанией, и самый важнейший приоритет для нас – это лидерство в науке, поэтому инвестиции в R&D имеют невероятно важное значение для нас. Но инвестиции в R&D можно сравнить с неким фундаментом, который необходим и просто неотъемлем для строительства всего дальнейшего в фарме, что происходит. Это вклад в будущее, развитие экономики, повышение качества жизни населения. И именно поэтому компания AstraZeneca ежегодно инвестирует в R&D примерно 5-6 миллиардов долларов по всему миру. В 2015 году эта цифра составила 5,6 миллиарда долларов. За этот же период в России, за 2015 год, наши инвестиции в R&D составили примерно 900 миллионов рублей. И мы считаем, что R&D, безусловно, является самым важным началом, то, без чего просто невозможно дальнейшее развитие фармацевтики здесь. В настоящий момент клинические исследования проходят на базе 350 центров в 45 российских городах. И более 6 тысяч пациентов принимают участие в исследованиях. Это означает для многих тысяч людей возможность получать современное лечение, и для многих это действительно вопрос жизни, улучшения качества жизни, и, безусловно, это очень важно для пациентов. Кроме клинических исследований, регистрационных, так называемых, компания также проводит пострегистрационные исследования, которые позволяют дальше изучать безопасность и эффективность лекарственных препаратов, которые уже находятся в обращении. Кроме того, мы активно сотрудничаем со Сколково в области математического моделирования в целях повышения эффективности разработки новых лекарственных средств. Это наш уникальный проект, можно сказать, когда российские ученые, российские математики привлекаются для того, чтобы помочь участвовать в исследованиях на самых ранних стадиях. Нужно сказать, что мы, конечно, не рассматриваем процесс исследований и инвестиций в R&D как нечто обособленное. Безусловно, мы также вкладываем в производство, и в 2015 году открыли свой собственный завод в Калуге, который уже активно ведет коммерческий выпуск продукции. И в прошлом году мы также приняли решение о дополнительных инвестициях. Еще дополнительный 1 миллиард рублей будет вложен, и мы рассчитываем локализовать еще 13 препаратов в компании дополнительно. Многие из этих препаратов не имеют аналогов, производимых на территории Российской Федерации. И мы подали заявку на заключение специального инвестиционного контракта, который надеемся заключить в ближайшее время уже в этом году. В середине прошлого года примерно Министерство промышленности и торговли утвердило список биомишеней, так называемых, да, которые будут разрабатываться здесь, в России, и мы не могли не заметить, безусловно, этого списка, потому что там много, в том числе, препаратов, которые предназначены для лечения серьезных онкологических заболеваний. Поскольку онкология – это один из фокусов нашей компании, для нас это крайне важно, да, и те вопросы, которые, так скажем, витают в воздухе, какой путь для себя Россия дальше изберет, пойдет ли по пути инновационного развития, будет ли это больше фокус на дженериковые модели, или это будет некий смешанный подход, это ответы на те вопросы, ответы на которые, наверное, должны быть в самом ближайшем будущем даны государством, да, с тем, чтобы компаниям было понятно, стоит ли инвестировать, как дальше продолжать инвестиции и куда инвестировать конкретно.
Спасибо большое. Я такой плавно мостик сразу переведу теперь к дженериковым компаниям, коль мы заговорили о дженериках и в том числе об R&D. Хочу дать слово Анне Ярвиц, компания Teva. У меня следующий вопрос. Анна, как текущие изменения и требования влияют на принятие решения об углублении локализации и рассмотрении возможностей передачи технологий, и в том числе, возможно, производства субстанции, коль мы заговорили о дженериках?
Спасибо, Дмитрий, за вопрос, спасибо за приглашение. Поскольку проект постановления находится на рассмотрении об углубленной локализации и об ограничительном участии в государственных закупках в связи с этим, мы отнеслись к этому очень прагматично и решили, несмотря на то, что фармацевтическая компания всегда и не обязательно занимается производством субстанций, углубиться в эту тему и несколько ее поизучать. Teva интегрированная компания, у нас есть 19 заводов по производству субстанции, и эти 19 заводов находятся в 10 разных странах, и из 1000...
And out of 100 and 1,800 molecules, 340 would be produced at our own factories. So it is not compulsory. So that the substances just pay off. It means that the open market and substances would be a guarantee for the economic efficiency for each decision made. Today, this market is dominated by China as a producing site with approximately 1,600 companies producing substances, and the turnover of this business is $9 billion. India with $7 billion, Germany 3.5, Spain and Italy. Spain and Italy, for traditional reasons, we know that Italian pharmaceutical market is very fragmented. Very many private companies and public companies that actually produce some substances, most of which are quite complicated formulas. They're not generics. And countries like the United States and France, the production of substances is primarily innovative, not generics. And also, hence the question, if Russia will travel the way of deeper localization, and this is a requirement to producers and some restrictive approach that may be practiced. So what are the reasons for that? Economic reasons. Under a big question marks, because the volume of the Russian substances market is 1,000 ton, 11 produced and 11 tons purchased. So the market is small, and we may hardly want to produce, the whole Mendeleev chemical chart in the air and in the soil. So we need to use a very high environmental standard, but it's very costly. Once we compromise on the standard, so the question is, where is the advantage? Yesterday at the plenary session, they told clearly that the future is the technological competition, belongs to the know-how competition. It's not industrial competition anymore. So once Russia selects the technological competition, probably we should go for the innovatory substances, R&D, focused R&D, and generic substitution where possible with maximum cost saving in the production cycle and incentivizing the generic substitution. That will be the balanced model, providing the room for the R&D companies and innovations and new technologies, as well as the availability and accessibility of the drugs through generic production. So building a plant in Russia, in Novoselki, we are now having 500 million of pills. We're going to increase the capacity to 2 billion, and we believe that with the necessary competences in substances production today, we don't think it would be wise to transfer the substances production into Russia. So the global approach will allow us to keep the high competition level and the purchasing level. So this was the position that I would like to share with you. I thank you very much. Now let us give the floor to our regulator and ask Timofey Vitalyevich, not exactly about regulations, but about the consequences of the initiatives, latest initiatives for the investment climate, including the pricing regulation, the restriction of access to foreign drugs, licensing, and what is the impact you believe it will make on the pharmaceuticals market and the healthcare? I would like to hear from the regulator now. Well, if you let me, I shall answer this question, and I would like to support you with a discussion about the healthcare, because we shall have a special session on drugs where Vitaly will ask us to talk in detail. So this is a kind of a warming up session. So as we are talking about healthcare as a whole, drugs are very important, but not the only component of our session. As for the regulatory initiatives, I believe that they are good. They are making the market healthy and return many entrepreneurs from the risky endeavors back to the firm ground. You cannot just plan and get such profits in the developed market with the drugs that are not good for that. So there are innovative drugs, reference drugs, and the regulation of prices for them would be rather an informative character and comparison to the reference countries. It would be right, because creativity cannot be assessed. It's just, the people who buy the drugs create the demand and supply, so they meet somewhere, and hence the price will appear. And it happens within the healthcare ministry that would develop the policy in healthcare, and they would generalize the clinical practicing. They say, we need this drug and we can spend so much on it. And so that's how we get the price for innovative drugs. But we have so many drugs that with the expired patents, and they're still very expensive because the competition is weak, virtually non-existent, and the weak competition has to do with archaic regulatory system, mostly in the registration area. We have a wide variety of drugs being registered, forms and doses. Most of them is clinically nil, so there is no clinical confirmation of therapy of the use. So just to create the artificial monopoly in the market. And another problem is the anti-competition agreements. So the system that we are trying to introduce with the Rostech, Roszdravnadzor, with Ministry of Health, will immediately show sustainable links of some regional leaders with private companies. and that's where we shall know what to target. So making the market more transparent, better pricing, bringing the prices to the indicative methods, to the average mean global prices are good initiatives, and we welcome them, and we believe it should be done in order to cut this kind of bazaar in the Russian market. And so many companies investing in Russia consider our issue, all the regulators in all countries, our pharmaceutical and country markets kind of local. And the companies that work together on 100 markets are global, and that's clear that they operate in Russia differently from the American market. They actually operate within the local regulatory system. So our goal is to upgrade the regulatory system, make it as good and transparent as the benchmark markets. This is the central issue. I don't blame companies for operating, cutting corners, making profits in the Russian market in the way we dislike. But that's their target. If they can practice piracy in the market, yes, we can see it, but we have to fix the regulation. We have to introduce liability, responsibility, so then arrange surveillance over the turnover. We still have 3 agencies supervising the turnover. So Ministry of Health register controlling, Minzdravnadzor, licensing is done by Minpромторг. So this is a unique situation, unique story, unprecedented. And if we want to make the market transparent and the prices objective, we have to remove such cumbersome system and improve the legislation. Speaking about the investment initiatives like you mentioned, we welcome the reasonable, balanced protection of the Russian producers from bad competitors. Pharmaceutical and medical markets are very much subject to unfair competition, and we have special department controlling it. And approximately half of all the claims are from the pharma companies. There are indirect ways and there are some direct ways to handle such claims that include some preferences, decisions and measures. And we now have a preferential system consisting of several parts. Some percentage at the purchase if the origin of the drug, for instance, is no good. When we have 2 Russian suppliers, so 2 and more Russian suppliers, foreign suppliers will be turned down. So definitely it does not go in line with the market and economic logics, but there is balance, there is still competition. But certainly we, as usual in this country, we have, when you get carried away, you cannot notice that when it's the right time to stop.
And so then, and this process starts go under its own steam, and you cannot control it, and so not based on the infrastructure capabilities of the state. And so we had the situation for 3 years, and so when there were some resolutions, and we talked to the ministries, so go into the details because they can just poison. It's a big victory of manufacturers. So these details, ST1 issuance, and so that poisoned everything. And so and the first who were damaged. Harmed, but failing to pay attention to details because it's Russian companies, because they had no certificate testifying to the fact that they're Russian companies, and that's why failure to pay attention to the details, actually. So everyone suffers, and especially Russian companies, And so then it's like a bicycle, you know, because we ride on the bike, and sometimes just we don't pay attention that some nuts or bolts are not properly screwed, and then the front wheel will come off, or the transmission won't work, and so that is why we need to be attentive to detail, so then this is the central issue of any regulatory framework. And so there was another question has to do with three-stage tender, right, and bidding. So we don't know what to do, because on the one hand, so we have no instruments that would allow to quickly fix that, and so identify the origin of the substance. It's impossible to do that. And so because this competition can turn into competition for a certificate, right? So grabbing the certificate, so not just to make sure that the substance is manufactured, but because by the certificate, because it's the certificate that actually determines the situation at the bidding. So the guy who has this spravka will be the winner of the bid, right? And so how do you define it? We need to change that. And then another thing, so if they introduce this system, then the opportunities to reduce prices for drugs will disappear. So and then there will be dearth of drugs, especially in the regional procurement programs. And as a result, prices go up, and then the accessibility will deteriorate as well. And so then a lot of money certainly will make money. So who will be able to bring the certificate to the bidding procedure, so that the substance comes from them. But there are doubts about the positive effects of that, and so that's why all these details need to be properly studied, and all the risks evaluated. So before we just go ahead first into it and support certain doubtful initiatives, and then certain drugs, so about medical support, medical help, healthcare, and so what concerns us very much is so there is this organization, Association of Medical Tourism, Russian Association of Medical Tourism, that evaluates every year, so then aggregates information. There's all the companies that do medical tourism, and analyzes, assesses, and in 2015 this association appeared and was founded, and its data shows that in 2014 so for medical help, 130,000 Russians went abroad to receive medical support, and this year it's 80 will travel abroad for medical support. And so this reduction goes because they want just to get the support in medical hospitals, but because devaluation, the weakening of the rubles, the sanctions, that's why they can't just afford to go. But otherwise there would be, so because the countries that concentrate their business on medical tourism, so the migrant problems is more difficult to get a visa. That's why there is a reduction in numbers. But the number of medical tourists actually increased. So we had 8. So then 8. So there will be more this year. And so then the quality is important. So then usually, so that's about 8,000 come to us for medical support, and so some people from Germany just come to us because their medical, their healthcare system is very expensive, and so that's why some Russians living in Germany so come to Russia for healthcare procedures. And so they're coming because so now medical care is becoming cheaper in Russia because of the devaluation of the ruble. And usually, so the Russians go abroad, so oncology, cardiovascular, so then high-tech medical support, diagnostics. That's when so many go for diagnostics, cardiovascular, oncology, so very expensive, high-tech medical service. And so they go abroad. And so then ophthalmology, so then they come to us. Then stomatology and orthopedics. So that's where we're strong. And so that's what the statistics says. So they come to us. So about 80,000 going abroad and 8,000 coming to Russia. So the difference is 10 times. And so some countries actually are financing Finland, South Korea, China. So they're financing their healthcare system at the expense of Russian medical tourists. and so they are, and so we have lots of Russians. So 80% of all the hospital patients, so they are from Russia, and then they then return to Russia. And so that bespeaks the fact that the competition is there, medical competition. We are losing this competition because we do not demonstrate any success stories. So we've made this program modernization, upgrade, equipment. Hospitals are state of the art. Everything is there. So we have private-public partnership. So we even in Skolkovo. So we vacated special, so no taxes for medical companies, so no oversight, nothing. So licensing is there except medical companies. You see, and so we have created this good cultivated atmosphere. So but the attractiveness is still low, and so that's why the citizens. So because we need just to return in investment, so state investment, and then attractiveness of the healthcare system for the citizens. So that's a lack, because if our healthcare system were better, so then there would be more people trusting our system, would be more people coming to Russia, and Russians would not be leaving. And so then traditional leaders is the USA. So now in 2015, now the leaders changed. Actually, it's very interesting. Now we have Singapore, is Taiwan, and Thailand, India. So they are the top list. So 50 years ago, so there was no healthcare system in those countries, and we had the Academy of Sciences, Medical Sciences, 50 years ago, and they had no medicine there at all. Yeah, so but it's much cheaper. So when you go for a surgery, sometimes price is not important. So because you want to survive the surgery, that's more important. As priority number one is not money. So when you're going for a surgery, certainly because it's where you trust. So the price and then trust for the system, medical system. And so that's why we need just to create this attractive system for the customers. And the most attractive system of healthcare is this system with very strict, very rigid system of control and oversight of healthcare. So that's where there is a total rigid control over the activities of medical insurance and the turnover of drugs, manufacturing, pharmaceutical, and the stronger this control and oversight is, the higher the investment attractiveness is in the region. So that's the rule of the game. So the more rigid, the better. So total control. So that's what I wanted to speak about. And so then regulatory framework is very important, and we need certainly to clean it up and improve it. And so then the better regulatory framework will certainly impact positively the future investments into this area. And so now let's move over to the Russian companies, and I'd like to address this question to Gregory Potapov, Pharmstandart company. And Gregory, your company has been cooperating with foreign companies for many years, very successfully. Could you share your experience of joint use of investments and so Russian companies versus foreign companies? And then you are very active in the Eurasian area, and so you're a member of the Eurasian Economic Commission, etc. And so you work there very intensively. So investments in Russia. So there is no one to invest, or there is something else there. Thank you, Dmitry. Let me try to answer in the following the main subject matter. So investments in healthcare. So today we heard, if we just sum up, so there are four areas that we verbalized today in the healthcare system that are of interest to us, and that are just as an object of investments. So first is production, R&D, then human capital, and eventually. And then, about 80% of our discussion has been concentrated on. So we've been discussing investments in the development of a regulatory framework in the country. It's very important. And I would not divide between Russian and Eurasian segment. Because the issues that we face, so we certainly are several steps forward ahead of our partners in the Eurasian countries, and but the task is the same. So although we're so far ahead of them, and so because it has to do with this bicycle. So bicycle is a good simile, a very good example of what might happen if you don't check the wheels. And so many partners who are here, so and I'm very thankful just to them for the opportunity for many years of fruitful cooperation, joint projects all together, just wonderful. And our major concern is investing in manufacturing facilities, and Russian pharma has learned how to do it. Now we know how to do it. International companies understand how it can be done. So investing in manufacturing facility, they understand who from Russian partners, among Russian partners, can offer a good, high-quality relationship, cooperation. So then the procedure of cooperation has been delineated, taken shape, and so there have been some cases already. So there are good examples in different areas and different drugs, different medicines, medications, etc. So we have this all in good shape. But the main concern that we both have and our partners have is the follow-up development of the regulatory framework. And so this is so what the legal background will be. So what we spoke about, this is more summary. So we spoke about price regulation, right? So let me sum it up. And in different aspects of price regulation. So it's always there. And so for forming prices in the price lists, so they need to be reconsidered, and so we know that there should be state policy in this area, transparent for the players in this area about pricing. And so another issue, so I think that we spoke about that too, is an attempt to so efficiency of drugs, how well they work on a patient. So that's an attempt. So then, and building this fully formally so shaped form, so we can just always track down the efficiency of the drug, and how well it worked. And so just to put them on the register, on the list of the drugs that work better or work worse, and so that the treatment of the efficiency, so the value response, so then outcome based risk sharing. So without this, these systems won't work, and so unless we know that these drugs work or not, so then outcome based medicine certainly is very important. So we need just to create this database, and through pilot projects, through federal solutions, and of the Ministry of Health. And we need to concentrate on that. So this is where we can invest. So then I think that all stakeholders should, of the health system, so private and public regulators, so they should consider and invest in that. And so this is something that is coming up within the next couple of years. Then the Eurasian environment. I think that what we are up against, a few years of we need to calibrate, to adapt ourselves to the new processes. So then harmonization, leveling off, synchronizing, all this very important between us and them. And so coming back to what was said by other colleagues, we would expect from the regulators, so national regulators, Kazakhstan and the Eurasian Union, so to improve control functions, monitoring functions, oversight functions. That's what we expect from them, because there is room for perfection. And there is still a lot to be done there. And so this is both in production and in circulation of drugs, in both areas. And so then another issue, which is echoes yet another issue. So when we talk about the unified economic space and the Russian specifics, this is what this combination of protection of intellectual property, yes, and not to abuse different instruments on the other hand, so not to go to extremes, and so to protect but not to abuse, and not to put it to the wrong use. I mean the instruments of intellectual property protection. So happy medium. So let me recap what I have said and what you have said. So how to invest in the development of the pharmaceutical production. So how to do that? In which way to increase the capacities, manufacturing capacities in our countries? So how to bring new high-tech technologies in Russia that we don't have yet? So we know how to do that. We've learned how to do that. We're bringing it and we're doing it. The partners help us. We go step on step. But in order to make such decisions, we need within the next several years, 2-3 years, so it can happen overnight. We need to concentrate on improving the regulatory framework, and we need to invest more into this area. I would like to ask a question. So it's a Russian company, and so Europharm. Yeah, not Europharm, you're a Russian company, and remembering your experience with special investment contracts, what's their attitude to this new form of investments, this investment contracts? Could you please share what's your take on this? Europharm has become part of Abbott in 2014. So more than $200 million, so 3 manufacturing assets, and 2 assets where we in Vladimir and Belgorod Oblast. So here we need to point out not only the mistakes but the strength of the investment client, because very important in which region you operate and what relations with local administration you have. And so these 2 areas, so they are in the top 10 best investment climate areas for nothing. And they're the best. And investments mostly for modernization and localization and increasing the production of new drugs which are not manufactured anywhere else, and then professional training. So these are the things. So SPIC is a very attractive instrument, special contract, and we make use of it. It's true that as we learn this contract and learn this instrument better, so certainly some issues are raised. I fully realize that some issues certainly will be responded in the documents that are going to be passed and published in 2017. So there will be a reaction to that. But what's important is this coordinated effort of all ministries and their predictability in their actions, because sometimes we get the impression that it's a very lengthy, ordinary process, lots of coordinations, confirmations, permissions, permits, signings, etc., and that time and money is wasted, and that is why. And so then additional participants were added to the commission. On the one hand, it's good that the administration of the government will be involved. It's good, but at the same time, so how to deal with it? That's another issue. And so I liked the fact that any investment they have a goal, so social or economic outcome. That's why the survivability of the investment project is very important. It's very important that it's important for the regulators as well right now. And I think that for any pharmaceutical company, pharma company, so there raises an issue of the demand guarantee. Right, so there should be demand, because, for example, so if it's just sometimes there are no extra profits, because the survivability of the project is guaranteed by the turnover, and for us as manufacturers, so we need just to have to be sure that our drugs will be in demand. That's the only way we can justify our investment. And then I would like to concur with Timofey Vitalyevich and Anna Yarovets, because these special contracts will take place only if so they manufacture substances. Only then these contracts are possible. That's a big mistake. So because it does not, it's not right, because economically it's not feasible. And it's not reasonable to do that. So we need to coordinate the main message about the development of technological state-of-the-art high-tech healthcare system, so that will be reflected in the special investment contracts. We need to talk about the substance. So the essence of investments, terms, deadlines, coordination. This is something that concerns us most. can that, and we'll certainly we'll talk to the representatives of Ministry of Trade, but they're not here right now. Just we'll follow up on that the next session. Now I would like to ask Mr. Zakharov, because he works with foreign companies, with Russian companies, does business with them, and does a lot in the regulatory framework. And what's your take? Investments of international companies in contractual manufacturing in Russia, improving healthcare programs, have they helped the establishment of Russian pharmaceutical industry, or maybe there could have been a different way to do that? I think that this issue is not a provoking question, because all investment have been done in the last 5-7 years, so they helped, definitely helped, and all the investments made by Russian companies and foreign companies. So the huge volumes of investments that have taken place at different state programs. So Pharma 2020, all these huge amounts of investment. But besides Pharma 2020, there are regional programs. So the Ministry of Health, the Ministry of Economic Development, so all of the Ministry of Education and Science, and I think it's been very helpful. And so we're talking about two different conditions of the market now. So that's if we were to assess the pharmaceutical market. I'm not going just to talk by and large about the healthcare, but the pharmaceutical market only pinpoint. And before 2010, the market and the market, pharma market after 2015, there are two different markets, absolutely, from the viewpoint of competence of stakeholders, professionalism. So lots of Russian companies, several scores of large, fully established, fully fledged companies, and so have their own. So they increase their manufacturing capacity, competences, production. So full cycle of the synthesis, so chemical synthesis, biological synthesis. They're exporting. So huge new set of competences that we never had before. And then I need to mention the fact that clusters in St. Petersburg. Okay, so expanding, so the horizons of planning, not only 2020 but beyond. So then last fall we discussed the strategy of 2030 already. So then development of St. Petersburg, and as the pharmaceutical industry is the second largest after tourism in 2030, St. Petersburg. So then in the last several years, 8 new assets have been commissioned. So 5 new manufacturing facilities are about to be launched. It's a whole new industry, and it's a big driver. And so then regulatory volumes, technologies, from the viewpoint of approaches to production cycles. So this is the most highly regulated area. This is certainly, and that's why, for example, after pharmaceutical, we have cosmetic, then food technologies. So they just follow, and they're regulated. And then they use the same kind of technologies, but they said the more active the pharmaceutical industry is, so then the better off will be those who just go right behind it. And so where this, so similar methods of synthesis, biological, chemical, so that the regulation level is a bit less, but they will just follow suit. They will follow in the pharmaceutical industry steps. And so then we had this big discussion several years ago, and many companies were afraid to lose their market niches, and maybe originally it was just. So the development of pharma was kind of against the market, so because the pharma market was very competitive, has always been competitive, but now after 2015, so the situation has changed, and we see lots of transfers, agreements, and from this at this point, what we spoke about, like water and stone and the infrastructure, is saturated now. So the number of manufacturing sites in the Russian Federation is maybe not many new projects coming up, but by the expansion of portfolios, local, regional, number of technology transfers, partnership relations. Although so the number of sites will not be increasing very very rapidly, but so five technology transfers have been launched in St. Petersburg. So it's a new chapter to open. And then about substances. So everything is written down. So in the Pharma 2020, actually, effectively, it's a good strategy. Turned out to be very good strategy, because in spite of all the difficulties, so we're following by a plan that was originally delineated. So while the first part of the strategy was dedicated to the segment of state procurement, and we see how it changed, so then high cost nosology, and so then the list of those drugs. And I think by 1920, so we'll get to the indicators that originally were planned. And then now the strategy has this transfer to innovative. It's just not a good word. So there is an economic strategy of the Russian Federation, and that's one of the main tasks that guarantees the national and state policy, which is development of non-commodity exports. Non-commodity exports, and in pharmaceuticals, so the full cycle of substances is one of the major important things for the development of non-commodity exports. And this is very important. Besides the Eurasian areas, so they are expecting just to go international with ready drugs, with finished drugs. And if you have your own cycle, if you have your own substances, if you have your own production assets, then you can export them. And this is the development of the non-commodity export forms. And so if you don't own the technology, then nobody needs you abroad. That's why you need to own technology. That's why for those several scores of innovative Russian companies that have shown in the last 5 years that they move very quickly, and then they that they have plans for good development in future. So their main task is so that they would be of interest to internationally, and the state speaks to support the development of the substances, full cycle, because only full cycle, only your own substance. This is the only way to develop exports of the company, and so this is the non-commodity export development. Has been the
That's why always trying to be very careful. Don't put everything into one basket. So speaking about the state procurement segment and supporting the local requirement is one thing, but developing the industry is another story. So there are different tools, selective mechanisms that the government should use to address those totally different goals. You cannot just merge them into one and say this tool is bad because it harms that sector. These are different sectors and different tools should be used. So I would say that the industry, unlike other industries, showed growth rates like no other, and we have very high expectations for the next 5 to 10 years. Huge number of projects under development that we have, and then Russian companies are growing. And another thing, in St. Petersburg, along with private companies' investments, over ₹1 billion investment into the educational and scientific infrastructure. That's what company cannot do. They cannot develop the universities. And they can probably do it in partnership, but investment in the infrastructure and human capital is what they cannot do. They have no capacities for that. This is what we have done over the last 5 years, and I believe it is very important for the future. So my question now, thank you. I would like to ask Arkady, please share with us about the criteria and indicators of return on investment. So, investing your time, what was your reason? Thank you. In fact, our discussion today is very relevant to the current situation, because the success of pharmaceutical companies are absolutely unprecedented, cause no questions, a huge success. Western companies keep investing, Russian companies, R&D enjoys a incoming flow of money. And today we are talking about pharmacology, pharmaceutical industry generally. And as for the healthcare, we are virtually not talking. So today we even heard the word warm up, and tomorrow we shall go and talk about the pharma industry. So I believe it is very important. We understand why. Because from the ROI, from the payoff, no one will invest without hoping for ROI. So pharmaceutical industry, at least